Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
Welcome to the College Connection podcast. The College Connection podcast is made available to registered nurses and nurse practitioners as a resource to promote good practice and to highlight the importance of regulation in healthcare. My name is Kelly Kane, and I'm a registered nurse and a nursing consultant with policy and practice at the college.
And I'm Michelle Carpenter. I'm a registered nurse and a nursing consultant for policy and practice at the college as well.
We have an excellent show for you today where we will be discussing the recruitment of RNs in Newfoundland and Labrador Health Services. And our special guest today is Collette Smith with NL Health Services. Welcome, Collette, and please introduce yourself to the audience.
Thank you. Pleasure to be here. Hi, everyone. As Kelly said, my name is Collette Smith, and I am a registered nurse as well by background. Really thrilled to be able to share some information and talk about the impact of what's happening in the recruitment world for the province with our registered nurse community. I graduated way back in 1993, and a shout out to my St. Clair's colleagues from the old diploma school system. So really reflecting my age here, but did go on to do a bachelor's degree and ended up into the world of human resources. And it's been such a great learning for me as a registered nurse to see that side of the world of healthcare and be able to have a voice at the table for recruitment and retention for all of our team. But with the registered nurses, of course, it's near and dear to my heart. So I'm really happy to be here. Currently, I am the Senior Director of Recruitment, Retention, Education, and Culture with Newfoundland and Labrador Health Services. I took on that role when Newfoundland and Labrador Health Services was formed, and it's been quite the journey, as I'm sure you can appreciate, and we'll talk lots about as we form this new organization in today's environment and world for registered nurses and the rest of our team across the province.
Great. Well, welcome, and we're glad to have you here today.
Thank you.
So over the last 2 or 3 years, we've heard a lot about recruitment and retention of registered nurses in Newfoundland, specifically within NL Health Services. Can you tell us a little bit about the current landscape of RN recruitment?
Certainly. It's been quite a challenging number of years, hasn't it?
Yeah.
And I don't think there's any registered nurse who's listening to the broadcast that would not appreciate the challenges, not just in the province, but across the country and, in fact, internationally, that nurses have experienced over the last number of years. Not only did we know we were facing a potential gap in services in the clinical practice environments that we have, but then, of course, we had our experience through our COVID journey.
Mm-hmm.
And we found what happened during COVID was that people were really experiencing a lot of different stress in the workplace, more so than normal. We had a lot of people who decided actually to leave the profession. We had a lot of people who gave everything throughout that experience and were thankfully and really graciously retiring and enjoying the end of their career and transitioning into a different phase in their life. And we found ourselves very much behind in our ability to stabilize and be sustainable with our nursing resources and with the demands that the patients were presenting with after COVID. I'm sure everyone here would recognize that the impact of those years on not only nursing, but the population in general it's made a demand for healthcare that we have seen unprecedented, service demands and levels that are needed. So at a time when nurses are feeling very vulnerable, tired, have been through a challenging time, the demand for our service and our profession has actually gone up. So a mismatch has occurred, and I'm sure everyone would agree we're certainly feeling it. What we've tried to do is stabilize with our recruitment efforts the numbers of nurses that we're working with to help each other and make sure that the quality of care is present and that we're able to provide it to the patients. So in recruitment, we've obviously been working with all of our partners across the province, across the country, and even internationally.
Right.
And we focused on our current new graduates. We've always had the very fortunate position of having top education systems within the province for our baccalaureate program. We have 3 campuses traditionally, and you might be aware that we've added 3 additional campuses in the province.
Yes.
We're going to see our first graduates from those campuses next year.
Absolutely.
And so by investing in our own folks who are interested in the nursing career, we've really started to see the benefit of those numbers of graduates. And they work very closely with us throughout their academic journey. We work very closely with the students to try and present them with clinical experiences that will give them an exposure to different areas of the province. Communication, relationship with students is one of the key recruitment strategies that we have. We meet with the students right from their first year of their academic journey. They do most of their clinical experiences with us. And for registered nurses out there who take on students, who preceptor and who teach amongst the front line, as well as many other roles, thank you. What you teach and the investment you're making in those students and in nursing in general is invaluable. There's nothing that could replace that in terms of the benefit of building our nursing profession and community. So we work with the students then to make sure that they know what opportunities are available to them in the province. And we've been quite successful in recruiting most of our new graduates within the province, and they choose to stay in the province.
Excellent.
We understand that's been challenging at times as well. There are a lot of clinical preferences that folks have within their own taste and within what attracts them to a certain area in nursing. We try our best to match that. We can't always, but we do try to work towards that. So the student journey is really critical, again, as one of our major recruitment initiatives.
Yeah, so student initiatives being a recruitment strategy, like you said, what are some of the other recruitment strategies that you have employed?
Sure. So we know then that we need to reach beyond our province.
Yeah.
We know we need to diversify, and we know we need another route to attract talent to the province to help us. Our communities are aging, as we said, the demands are up, and we need help to meet the needs of our population. So we intentionally have done a few things outside of the province. First and foremost, we're out there nationally on the scene for Canadian nurses. We, with the partnership of our Department of Health and our government, have been able to implement some incentives to gain attention and attraction, because we believe once people learn about opportunities here and actually practice here, they love it and they will stay. So we have attracted folks from within Canada. And we also have moved into the international market for nursing recruitment. We're learning here too. We haven't really done much before the last few years in international recruitment. So together, we've all been learning on how we could best benefit both our nurses who are new to our team, as well as the care and within the province, and to folks who are already practicing here. So we have done some intentional missions that have been supported by, again, the provincial government and the Department of Health. It's really interesting how we ended with our target areas that we did work with. We've been working mostly with India as a nation.
Okay. Yeah, sure.
And we've done a little bit over in Dubai. Of course, we welcome all international interest. And you would have probably seen some escalation of applications for licensure from some of these countries. But the reason that we focused on India was because the curriculum in India is very closely tied to Canadian curriculum. And while there are some differences, what the nurses learn in that curriculum does match most of our core and basic competencies. And as well, in the area in India, which we're working with applicants from, they teach in the English language. So we know that folks are comfortable then in their communication skills, which is so critically important. And we do work a lot with people along the way to enhance that communication skill even further. But the curriculum is taught in the English language. And the other thing we're really, really conscious of is ethical recruitment.
Absolutely.
So there are countries, not a lot unlike Canada, that find themselves with a shortage and gap in their nursing supply. And countries who actually are really struggling even more so than we are. And we're really careful that we don't recruit from a country that needs to sustain their own services. We really don't want to disadvantage anyone by our recruitment efforts. In India, actually, there's an ample supply of graduates
Okay.
from the programs that we're working with. And in fact, the governments work together
Okay.
to actually allow us to come recruit. And we meet with them regularly to ensure that we're doing it ethically and safely, and that the impact on the services in the home country is not such that we are compromising anything there.
Mhm.
So it's been fantastic. We've been to India, our recruitment teams. We've had professional practice with us in India to meet applicants who are interested. From a recruitment lens, we make sure there's a good match, that people understand the environment in which they're coming to join us, and that we can have success in retention as well once people join our teams. So for recruitment, what we've done again is match the student supply, invest in our own.
Mhm.
We've reached out nationally, and then we're augmenting those numbers by diversifying our recruitment pipeline into international communities. Again, very new for us, so
Yeah.
we'll share lots of learnings in it,
Mhm.
but we're hoping by increasing the supply and the routes by which we can attract nurses that we are moving further towards a sustainable model to meet the demands that we currently have in the province.
Absolutely. And Colette, when you were talking, I mean, really a nursing shortage globally. Hey, like when you talked about ethical recruitment and how some countries, Canada is not unlike other countries in the world right now experiencing the
Yeah.
shortages in healthcare.
You're absolutely right. There is a gap across the world. We're a very important profession and
Absolutely.
very high in demand. And it's a challenge because everyone is experiencing the same thing.
Absolutely.
But we're learning a lot from each other. It actually
Yes.
gives us a good community,
Hmm.
especially in, as I said, new methodologies that we have to try and stabilize, such as international recruitment.
Yeah.
We're not the only ones trying to learn how to do this well and how to do this best to support the nurses who are working here currently, and of course, the people who are joining us new to practice within our province.
Absolutely.
Yeah. So it seems that the recruitment strategies have been very flexible and very responsive to the need within Newfoundland and Labrador. So, Colette, we've heard from our nursing partners about these workforce challenges for the past couple of years. What, if any, progress has Newfoundland and Labrador Health Services made in addressing these challenges with those gaps and vacancies and things like that?
Sure, and it's quite complex, and it's a huge system to try to turn. And we are making progress. I do appreciate on the front line, it's still quite busy. Our acuity levels are very high, and it certainly is very demanding. And the results of all these efforts are definitely not being felt in their entirety yet to you as nurses out there trying to care for patients and residents and the community in itself. But we have decreased our vacancy
Okay.
numbers. We have quite a number of people currently who are in different phases of onboarding, including within the province. We have upwards of 200 international nurses who have joined us within the province,
Okay.
and they have joined us in communities that we do normally try or find it very difficult to recruit to.
Wonderful.
So while we're transitioning to independent practice with these folks, it's been quite an investment in education for people. We know that you as nurses on the front line are mentoring quite a lot of new nurses to us. We've enhanced the educational programming for these international nurses. So quite soon you will see over the upcoming months people moving towards independent practice and hopefully starting to stabilize
Hmm.
quite a bit. We also have increased, as I mentioned earlier, the percentage of new graduates that we're retaining. And so we're upwards in the 90, low 90s, 90 percentile of new graduates
Okay.
choosing
Good.
to remain in the province. So that is great progress. The percentage of people being able to avail of permanent full-time positions has increased as well. So we're really trying to be creative in meeting people where they are. One interesting thing that, again, learning as we go and trying to listen, trying very hard to listen to what people are looking for, is that the traditional model of relocating to some of our more challenging or smaller, maybe more remote areas moving and relocating there is just not possible for a lot of people.
Mm.
And we're trying to find our way in how we can make it work for nurses to work in those areas, but who need to live elsewhere. And so we're working again in partnership with the nursing union, as well as our provincial government, to see if we can come up with some creative solutions that we haven't tried before. Things such as fly in, fly out models. Can you potentially make that work? Can you accept a position in another part of the province, and we'll help you adjust schedules, adjust ways that you can be present in that area, but again, meet your own personal life balance to live elsewhere. And so we are seeing some beginning interest in that very early in those stages. But I guess to say to you that we are trying every flexible option that we can, because we know we have the supply built now. The challenge is matching the supply to where the need is in terms of our vacancies.
Absolutely. And that's a really key point. So we hear a lot about now, both nationally and provincially, about workforce planning. So what initiatives are, Newfoundland and Labrador Health Services doing with workforce planning, and who are you collaborating with that planning?
Excellent question. And workforce planning, again, has become very necessary. In past years, when the nursing volume of graduates and the needs that we had in the province were more closely matched, it kind of fluidly fell together. And so our workforce plan was really more centralized on local graduation, and the numbers did match what the needs were within the province. That's not so anymore.
No.
And so what we've had to do is learn how to workforce plan in this complex new world where everyone is competing for the same resources. And where, quite frankly, nurses, all of us have the choices available to us. And so we need to be listening to our community and plan ahead for what the needs are. What we've tried to do is gauge predictability in terms of what the care needs will be, what our population as a whole will demand of us as a profession and as a healthcare system, and then make sure the supply is matching that. And that sounds easy, and it's not easy. It's not easy.
Absolutely.
If you think about the healthcare system across the province, and now we have this provincial view as Newfoundland and Labrador Health Services, it is complex. We have facilities and care in every area that you know of within the province, and we need to sustain those services. Absolutely. We also have a centralized tertiary system, which is mostly based within the St. John's area, and a number of secondary hubs throughout the province. And then, of course, we have our unique geography that everyone would be familiar with, and beautiful, beautiful communities throughout the province and up into Labrador, but very difficult for a family to start sometimes, or a person to be able to pick up and relocate to those areas. Absolutely. And so what we need to do is be able to predict the services in every community, taking into account, of course, the direction of the health accord, which has us shifting from inpatient models, hopefully out to a wellness model where we're providing more preventative public health wellness services.
Absolutely.
Take into account our age demographics, so the demand for some of our chronic and long-term needs are increasing. Our young population needs are shifting because of that population demographic. And then figure out how many of registered nurses, other skill sets we need to be ready with to provide that care and sustain that care in the province. But we're learning how to do it.
Yeah, absolutely.
We're not perfect, which is where we're stumbling a little bit. So you're feeling that, but we are trying our best to learn. And where we are now is being proactive in trying to establish those numbers that we need, knowing how many of us may be retiring in the upcoming years, how many nurses we may have on different types of wonderful leave, like maternity leave. What are the gaps that we might experience as a normal workforce? See how many of our local graduates are taking positions with us, and then how do we make sure we have then augmentation of that supply to make sure we're not behind? Because when we're behind, that's when we're really feeling it on the front lines.
Absolutely.
And you're feeling it. So our plan is really to figure out those numbers, which we're very close to refining. We have community partners who are embracing our new people into our
Oh, that's good.
communities. We've been partnering with municipalities NL, both things like housing, settling into communities, so quite a number
Mhm.
of partners. And I would be very remiss if I didn't mention the college, who's been an
Absolutely.
extremely supportive partner,
Mhm.
both the CR and NL, as well as with our licensed practical nursing
Sure.
college.
Mhm.
So most of you would be aware that we've had some licensure changes
Mhm.
within the province. And the regulations have allowed us to succeed in this international recruitment because the countries under the assessment of the college
Yes.
that we know are akin to our own curriculum need to match up with where we're recruiting. So if
Absolutely.
someone is going to be successful and understand the licensure requirements and our competencies and our regulations, it makes sense for us to recruit from the areas that you've seen as a college
Mhm.
that do align with what our experiences
Absolutely.
is within Canada and even Newfoundland and Labrador. So huge partnership as well over with the licensed practical nursing world. I mentioned that college.
Mhm.
We've been internationally recruiting as well for the licensed practical nurses in the same vein as what we've described here with the registered nurse community today. So again, just fabulous support. Everybody has one thing in mind, and that is the success of having enough resources for our teams to safely take care of the people within our province and to have it that people are safe, content, and able to do what you want to do and need to do as a registered nurse.
Mhm.
No, absolutely. And you talk about the college, yes. We have tried to be responsive and to help our partners as well. And we've worked with government across the different jurisdictions to create different pathways. We've updated our resources. We have, information for internationally educated nurses to get the necessary information when they have a job offer from Newfoundland Labrador Health Services, and then how to as quickly as possible get that licensure so that they're able to, start their journey in Newfoundland and Labrador. So it's great to hear that. So, Colette, anytime there are workforce challenges, it is the individuals on the front line who feel the effects the most. What would you like the RN community to hear with your respects to these efforts?
Absolutely true. And it's not lost, and believe me, we do recognize the stress that's been there for the frontline registered nurse and other practitioners within the community. First and foremost, I want people to know that we hear you, we are listening, and we're trying to make a plan that's going to make this better and stabilize the community within our province. It's a huge ship to turn, as I mentioned earlier. So we're hoping that you're starting to see the effects and the fruition of these efforts. We do still have quite the challenge, but we are moving towards stabilizing. So we do see a forecast of increased stability within all of our clinical areas. We've already shifted the tide within some of our clinical settings. We do have quite a challenge now that we have a lot of new practitioners and new nurses, even new to the province, within our system, that we have to take it very slow and safely.
Right.
So we have to make sure the skill mix is correct. We know also there's a lot of investment from the nurses who have some experience within our nursing community to teach and educate people who are new to practice with us. That's been quite complex as well. We do hear from our nurses that we know that it takes a lot of effort and a lot of investment from the individual nurses. And so we're slowly but steadily building our resource pool within the province. The next piece we'll do is start to look at some of where the gaps still remain and continue to build our pools. We need to find a strategy and work with you on how to fill some of the areas that are complex and are specialized areas
Absolutely.
where it may not be appropriate for new practitioners to enter. But we also need to recognize that the supply of experienced nurses is just not present as it was in the past. So we need to find a way together to do that safely and invest perhaps in more intense education We have a lot of academic partners that could help us. How do we stabilize on that end? So the main message I'd like to hear for people to hear today is that we do recognize the challenges that still exist within the system. We are well on the road to hoping to help solve some of the issues. We do have a plan going forward, but it's going to take a little bit of time and investment to be able to stabilize. And we want your voice with us to continue on this journey because we still have a lot to solve. But we're here, and our goal is your goal.
Thanks. And to me, it sounds like you're creating hope for nurses in the system. So that sounds really great.
Yeah, it's interesting. Probably something we need to do a lot better on, and thank you for hosting us today, is the communication to the front line. I know I was visiting a unit not that long ago. It was one of our ICUs, and I was talking to a registered nurse there who expressed just how stressed and how big the demand was on the nurses within that unit. And I shared some of what was happening within their own actual facility and site. The fact that we had recruited into medicine and surgery, the fact that the next step would be how do we train people to support that particular unit was ICU. And it struck me because that nurse didn't know.
Yeah.
And she said at the time, well, thank you, I know. Now, at least there's a plan.
Absolutely.
There's a plan and someone's trying something. And not to say we definitely have this all correct or that you're feeling it now or that it's perfect, but we are starting a plan together and starting to see some of the impact, hopefully.
Well, thank you.
Good. So, Colette, I hear you talking about some of the registered nurses who are currently in the system, and if those registered nurses are looking for a way to contribute, what role do they play to ensure that these recruitment strategies are successful?
Pivotal. I don't think there's anyone who would disagree that the most important relationships we have in the workplace are with the people that we work with every day.
Absolutely.
The manager that we report to and the colleagues who are side by side with us. And so it's really important, despite the challenges and the stress and the balance that you're likely not feeling, again, the full impact of yet, that we do support our new nurses to those units. The main role that the registered nursing community can play now is to welcome and embrace and teach. I think we know we all have a responsibility to educate our new nurses, excuse me, whether they be new to our clinical setting, to our province, or new to practice in general.
Right.
And I know everybody is trying their very best to do that. So continue with that. Welcome. We want to retain people. We want them to feel welcome into our communities. We also have a responsibility as a registered nurse community to raise if there are certain issues or things that we need to be aware of in terms of practice, but also in terms of the stability on the units. And I know you're trying to do your very best to raise that awareness. We have actually shifted the way that we're educating and orienting because of some of the feedback we've already heard from registered nurses. So that voice is critical.
Absolutely.
I know that sometimes we are feeling, all of us, very frustrated because of the demands on us. And it's a lot then to come forward to help problem solve. But we need registered nurses on the front line to help us problem solve through this. As we're trying our best, we're not on the front line. You are. And we need to hear your voice to help us with some solutions if we haven't hit everything that you can think of that we should be doing.
Absolutely, Colette. And when you were talking about the responsibilities of registered nurses, that going back to the standards of practice for registered nurses and nurse practitioners, and in standard 1, responsibility and accountability, bringing forward any actual or potential safety concerns for clients. So, nurses have a responsibility to bring that forward, but also, being a good role model and being a good leader and collaborating and communicating in the best interest of the client. That all goes back to the standards of practice for registered nurses and nurse practitioners. So I'm glad that you brought up those responsibilities.
Absolutely.
And it include me, and when you were talking, and is in the standards as well, is that expectation of professionalism. And I know there's many challenges in the workplace, and while there are efforts that are being implemented, it's going to take time, as you've said. So there's still that expectation that when someone is new to the unit, like you said, whether in practice or from another area, but is that expectation that you communicate effectively and you collaborate, and having that respect for each other, and not saying, well, you should know that, but being that role model and sharing that nursing knowledge, because that expectation's in our standards for sure. So thank you for those examples. So there's been a number of lessons that have been learned over the past number of years as NL Health Services has embarked on these recruitment strategies. But what would you say are some of the biggest takeaways that you can highlight since deploying these recruitment strategies?
One of the biggest lessons is to involve the frontline professionals more than we have.
Okay.
We've been very challenged ourselves through a lot of the experiences we've all shared in our different roles throughout the past number of years. And I think it's fair to say we've all been head down working really, really hard to improve things and to make it through successfully and stabilize within Newfoundland and Labrador Health Services. And sometimes we forget to talk. And we need to get out there and talk more to people. So the biggest lesson we've learned over the past number of years is to hear and embrace the feedback from our frontline and create an avenue that they are comfortable and feel that we're listening, but also show what we have done with that feedback. It's really interesting because a lot of times we do actually change course based on the frontline feedback, but people don't know or hear back about what has happened. And that's really important because you are contributing actually to the design of everything that we're talking about today, and your feedback has been invaluable. So that frontline involvement is one huge lesson for us to learn. We've had a lot of challenges with the pressure on the number of new people and the number even of student experiences that are happening on our clinical units.
Yes.
And we're relying on the registered nurses to embrace and to take people under their wings, as we've said. And while we do know it's a professional responsibility, we also know how difficult and what a large amount of attention, work, and investment that takes from the registered nurse.
Right.
So we need to find a better way also to support the folks who are taking those learners on.
Right.
We haven't done a very good job of embracing together that community and making sure they're supported. So we are starting with some preceptor education pieces of work, with a community of peer support across that. So supporting folks who are helping actually leverage this strategy has been a huge learning. We've learned quite a lot in the world of recruitment. You need to recognize, even though we're recruitment within healthcare in the province, we haven't had to be big marketers or big strategists in recruitment, because we've had the luxury of having our own schools within the province.
Absolutely.
And us as Newfoundlanders and Labradorians often want to stay home. We build our lives. That's not the world anymore that we live in. We've had to learn how to recruit. And so just to recognize and thank the HR team, actually, who've also gone through their own transition and huge practice change, if you can akin it to what the registered nurses have experienced and are learning as we go too. So just that whole collaboration and the lessons of partnership across the world has been incredible.
Wow. Excellent. Colette, even going back to, I remember myself being in nursing school, we would hear about this looming nursing shortage that was coming, anticipating 2020. But I don't think anyone could have anticipated, where we are today, provincially, nationally, and globally, of course. Where do you see the RN workforce in 5 to 10 years from now?
What a journey. We couldn't have predicted this, I don't think.
No.
We were predicting a gap.
Yeah.
And I think we invested up front in it, and no one could have predicted, I don't think, the pandemic and the effects that's had on our workforce, and again on the health status of our people, as well as just what people are expecting from work-life balance. It's changed perspectives quite intensely for people. But in 5 to 10 years, I think that we'll have turned the corner in this phase of our nursing history. We will have a diverse nursing workforce who are stable within their own communities, who have all kinds of different creative work-life balance options, because we're trying to create those every day. I think you will see the scope of practice continue to expand. I think you will see more interdisciplinary means of taking care of people. And if you go to the vision within the province of the Newfoundland and Labrador Health Accord, we're going to be a healthier people.
Absolutely.
We will achieve that. And our work as registered nurses will be out in the public to continue that wellness journey and a lot of disease prevention, chronic disease management, and supporting healthy, happy lives well into a longer lifespan. So I think the shift of the acute care, intense work will always remain.
Yes.
But you will see an increased focus on some of those other avenues that we can have such an influence on as registered nurses.
Absolutely.
Excellent.
And I guess I anticipate, as you said, the way we deliver healthcare will change as well, with as the needs change and our resources change. So thank you, Colette. That concludes our episode with Collette Smith from Newfoundland and Labrador Health Services. Thank you, and thanks to our audience for tuning in today's episode, Recruitment of Registered Nurses in Newfoundland and Labrador Health Services. Remember, all episodes of the podcast can be put towards your continuing competency requirements. And also remember to subscribe to our channel, and we encourage you to like, review, and leave a comment wherever you can. Take care. Thank you.
Thank
Thank you for having me.
Thank you.
Thank you, Colette.
This has been a presentation of the College of Registered Nurses of Newfoundland and Labrador.